at the age of 10 years old, I had a traumatic experience with a dentist, and that's followed me, over the next 30 years, visiting various dentists, various encounters that I've had with other dental providers. And over that period of time, I've run into dentists who have, been unsympathetic, who have shamed me, who have been, impatient with trying to partner, to help meet my dental needs. So when I was 10, I had to have an extraction done, and I remember being so scared, and the dentist was absolutely not patient with me and actually had to hold me down. They couldn't get the area numb, when they need to extract this tooth. And I remember the assistant and actually the dentist, like I said, holding me down to do this, and being able to feel what was going on. And so that precipitated again, this lifelong journey of having an extreme dental fear. So over the next 30 years, that adversely affected, my dental health as well as my overall health. I visited various dentists, again, over the years for different things that I needed to have done. Over those years of not going, from a preventive perspective, like I should have, that precipitated into, other dental issues where I had to have other extractions done, actually had other bridge work done over those years, and all of that was non-sedated. All of that was, I'm a hard to numb patient. And so even with taking other medications to try to calm my nerves, it was a traumatic experience. So about 5 years ago, I set out to improve my overall health, and I knew that dental was part of that, and decided that I needed to research. I'd heard, radio promotions and things on television about sedation dentistry, and decided to do some research to find out if this was a solution for me. And so I found the website for sedation dental care here, and with Drs. Dan and Tracy Davidian, and then actually found that they actually had coworkers, and actually a friend that actually had been here and had good experiences. So my first experience here was a good experience. I was welcomed, and actually with my first consultation with Dr. Dan Davidian, he actually listened to me. He was actually patient, and he actually partnered to find out what it was that we needed to do together to get, my dental state back to the appropriate place that it needed to be for my health. So I had extractions done and actually and dental implants placed when I was here. So I arrived at the office, early that morning, and was actually given medication to take, when I got up that morning and took that. And then I came into the office, and then they gave me additional medication. I remember that they were very caring and took care of me once I was here, made sure I had a blanket, made sure that I was warm. And I remember, they put the blanket on me and said, "We're going to take good care of you." And that's the last thing that I remember until it was time for me to go home, when they were putting me in the car to go home. So the day after recovery was probably atypical. I didn't have very much pain the day after. That wasn't bad. The next few days after that, when the swelling and the pain were there, but it was different from any other kind of pain that I felt. It wasn't the dental pain, that just my whole entire being ached that I'd had before. And I knew that this was a needed step to go through in order to get, back to the good state of dental health. making the appointment was the first major step for myself to actually make an appointment, keep the appointment and come in. Meeting the practice here, like I said, with them being understanding and being empathetic, I thought, okay, I can do this. I was a little nervous to come in for the day procedure, like I said, but they took very good care of me. And like I said, actually made me feel like a person and not just a patient. That you just have to take the first step, to trust, to make the telephone call, to make the appointment. You've been through it before, where you've had the practitioners, the dentists that that are not the best of dentists out there, for your particular type of fear that you have, or that your traumatic experience that you've been through. Just give it a try. You can come in for a consultation and meet the doctors here, and once you meet them here, then you'll know that you've found a home to come to. I'm more comfortable now. I actually just had my cleaning and made it through perfectly fine without having to have any type of sedation care. Again, that built the trust with the team here that I was able to do that. I come in now and I can come alone and actually come in by myself and have absolutely no problems with, like I said, meeting the practice here, whereas before I had to be sedated just to come to the dentist, and therefore I had to have somebody drive me. So if I'm coming just for regular, cleanings or those sorts of things that I don't have to be sedated totally, then I'm okay to come on my own. So the fear is totally gone from that perspective. It's helped me tackle my fear of going to the dentist. It's helped me tackle my fear that if I'm having pain or having an issue, that I know that I can call and come in, and I'm not terrified. I'm still a little fearful, but once I get here, like I said, then I'm reassured, oh, okay, this is a safe place for me to be. So the quality of life has greatly improved. Not only am I able to eat whatever it is that I want, I don't have to worry about, the tooth pain with things that you eat. I'm able to be confident when I have a professional conversation with someone, at work, whether it's giving a presentation or, speaking to a client. I'm able to, from in any social situation, like I said, able to smile and not worry about, what it is, the state of what my teeth look like.